The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. If you or anyone you know might be interested in making a television show, please call 260-421-1250. Access Fort Wayne is a department of the Allen County Public Library.
We're delighted to see you all, and I'm really excited about this topic. I'm especially excited about it because the Every Birth Network had a informational call earlier this week, and that what were some of their key findings? And food and nutrition is one of the things they've identified listening to people too. So kind of the affirmation of how important it is for us to pause, look at the resources in this community, the knowledge we have, and how do we really do better by our moms and children. So I think it's going to be a great conversation today. I'm Meg Disler. I'm the Executive Director of the St. Joe Community Health Foundation. Jackie Martinez is running alongside of me. We're kind of, I'd say a dog and pony, but I would say I'm the dog and she's probably the pony. I didn't want to call my colleague a dog. That sounded bad afterwards. And helping us to pull all this together is Mark Burkholder in the back. So if you have you need anything, flag any of us, or if you have a question. Starting the Prenatal and Infant Care Network, and this, as you all probably know, but if you're new, we do these quarterly luncheons for free, but to bring people together who are interested in any part of that continuum of supporting moms and babies so we have a healthier community. Our job is really to be pushing information out, education, so we have the best knowledge and we know who's doing what in the community and we can work as a community. And there's so many important players in this whole field. One of the things we like to do then to start this meeting is we like to have everybody quickly introduce themselves so you know who's in the room, what are the other resources in the room, and most likely there's at least one other person in here you've emailed but never met. And so you get a chance to see if you want to refer somebody to that other service. It just helps us work as a community. So with that, we are going to start over here and just have you quickly say your name, your title, your organization. You are allowed 15 seconds if you need to give an update on your agency you want everybody to know. But we do want to get to the speakers, so.
I'm Christy Cirillo. I'm from A Mother's Hope. I'm the outreach coordinator. Updates, we had in November reached a milestone of serving 100 women and babies since our opening in 2018. So that's a huge accomplishment for us. So yes, thank you.
I'm Melissa Keith, and I'm new to Parkview's Nurse Navigator program, so still learning everything.
I'm Karen Gruder, and I'm a pediatric nurse navigator with the Park. Okay. Yeah. So I'm, again, Karen Gruder, and I'm a pediatric nurse navigator at Parkview. And, yeah, part of our...
Jackie gets to run the mic. That's why we're standing there.
I'm Tammy Munson. I'm with the YWCA Northeast Indiana, and I'm a peer support specialist, and I work with women who have children.
I'm Sydney Wilson. I'm a social worker with Parkview in pediatric outpatient.
I'm Laura Pfluger, and I'm a social worker with Women and Children's Outreach, and I'm in the Carew OB-GYN office.
I'm Britte Nihart. I am a supervisor of the Women's and Children's Nurse Navigation Program at Parkview and the Allen County FIMR coordinator.
I am Brittany Wessel, and I'm an OB nurse navigator with Parkview.
I am Sarah Van Auken, and I am an OB nurse navigator with Parkview as well.
I'm Teresa Barker. I'm with the Hope Center, and I am over client services and the volunteers. And just a quick announcement, we're kicking off our car seat safety program in January or February, so we have 3 certified for seat safety check people that anybody can come get the car seats checked for free.
Great. I'm Angie Richhart, also from a Hope Center.
I'm Angie Phillips. I'm with Lutheran Social Services with our ECHO Teen Parenting Program, where we help pregnant moms and dads, pregnant and parenting moms and dads stay in school and graduate with their HSE or diploma.
Hi, I'm Julie Reese. I'm with Associated Churches, specifically with the Journey Beside Mothers program, which is a mother mentoring ministry, along with some other mother supportive, like community connection programming. And I, I'm the I guess my title there is I'm looking at this paper because I always have to be reminded. I'm the Journey Beside Mothers Director and Wellness Nurse. I do nurse visits to the mothers that are part of our program too.
I'm Jackie Franzi. I'm one of the quality coordinators at Lutheran Hospital, and I work quite a bit with our OB department and also in health equity.
My name is Kiki Hunter Davis. I am the nurse, what am I? I am the nurse care coordinator for community nursing for the family and children's team for community nursing, and I am the safe sleep care coordinator.
My name is Corey McKenzie, and I am the maternal child health bereavement coordinator at Parkview Health and also a social worker.
I'm Renee Cleland. I'm a birth doula. I take clients privately, and I also work with healthier moms and babies.
I'm Marcy Baker, community health worker with Parkview and for the specialty division.
Hello, I am Janae Moore. I am a community health worker with Parkview Women's and Children's Outreach.
Hello, my name is Jocelyn, community health worker with Parkview Women and Children Outreach.
So now we know every quarter we'll be reminded of our titles and we can practice it.
Hello, I am Amy Grabowski. I am with Bright Point Early Head Start, and we offer in Allen County Early Head Start home visiting services. I had to think the same thing.
I'm Jana Peters. I work with the Shepherd's Hand Community Outreach Center. We give diapers away for free once a month, and we do 4 quarterly health fairs.
My name is Jackie Schenkel, and I work with the Neighborhood Health WIC program as the Interim WIC Director.
I am Belinda Dean. I am social worker as well as certified community health worker with a neighborhood health clinic.
Hello, my name is Renee Hammett, and I am a birth doula. I take clients privately and also work with Journey Birth and Wellness and Global Birth Community, and I'm part of the doula network of Fort Wayne.
I'm Nicole Fairchild with Macmillan Health, and I'm going to let Sabrina give our updates.
Hi, I'm Sabrina Marquez-Stracely, and I'm the Director of Development Marketing. And our update is that we have a new prenatal nutrition category on our Healthy Tomorrow app, which is a completely free resource for prenatal, postnatal parents looking to learn more information about their pregnancy and what to expect when bringing baby home and much more. So check it out if you don't know about it.
I'm Leandra Woods, and I am with the Department of Child Services, and I am a family case manager, just here to gain more knowledge.
I'm Andrea Caldwell. I'm with the Department of Child Services as well, and I am a family case manager.
I am Brittany Fields. I am also a family case manager with the department, and us three is all part of the permanency of the department.
Good afternoon. My name is Sherry Early, and I am the director of the Every Birth Network.
Hi there. My name is Mindy Theard, and I'm the family coach manager with New Mercies Ministries. We host children for families in crisis.
Phil Pelz, Director of Operations at Wellspring Interfaith Social Services.
Lora Overton, I'm a professor, and I was a practicing physician for 30 years, OB-GYN.
wonderful. You know, when we talk about some of the tough things going on in the community, when you just look around you and you look at all the support and the network, and this is just a portion of it, as we know, we can solve a lot of these problems, and we can certainly touch a lot of lives. So thank you all for what you do. We're starting the meeting with Britte Nihart, and as she introduced herself, I will also, she's coming up, say she leads the local infant mortality review. So they look at the worst outcomes and figure out what can we do to do better in the community. And as they come up with their key messages, we found it very helpful for us to learn from her. She's a big part of this group to figure out what we need to be bringing to you all. Britte?
Okay. Food insecurity is a big component of FIMR, the cases that we review. It often leads to, I guess sometimes you might think ironically, but increased rates of obesity and all the associated problems, health problems that can come from obesity, cardiovascular disease, hypertension, diabetes, things that put pregnancies at a higher risk of complications. And this happens because usually the cheapest foods are oftentimes the least healthy. So as far as our FIMR data, what I could find, in 2023, the mothers with infant losses that we reviewed, 30% were at a healthy BMI at the start of their pregnancy. So that's not as big a number as we would like to see. So far for 2024, out of the mothers with infant losses that we have reviewed, 14% have had a healthy BMI at the start of pregnancy. Food deserts are something else that we look at, and those are defined by the USDA as areas with limited access to healthy, fresh, affordable foods. An area to be defined as a food desert has to either have a poverty rate greater than or equal to 20% or a median family income not exceeding 80% of the median family income in urban areas. So at least 33% of the population in an urban area has to live more than a mile from the largest grocery store and meet those poverty guidelines. Out of all of our Allen County FIMR reviews that we did, I couldn't quite get that for 2024 yet, but the 2022 reviews we did, 21% lived in food deserts in Allen County, and in 2023 it was 37%. One of the questions that our navigation team at Parkview, our OB navigation team, asks pregnant moms that come through is, within the past 12 months, the food you bought just didn't last and you didn't have money to buy more. True or false? In 2023 and so far in 2024, it's been the same. 8.4% have said that this is sometimes or often true, that the food just doesn't last until their next paycheck. So that 8.4% equates to more than 500 families yearly in Allen County. And those are just the ones that are coming through PPG-OB. So there's a lot of other, obviously, families that we don't ask that question of. Another issue that our team has noticed after we ask this question, if they do have food insecurity, we try to get them connected with resources, and then we check back up on them later to see if they got connected. Did you find help? Did you get your needs met? And what we hear often is that there's a lot of confusion about different food banks and food resources in Allen County, because each seems to have different guidelines for qualification, different, obviously dates and times that they're open and available, and then requirements for vouchers or other paperwork to help them, or for them to prove that they qualify. So hopefully that's something we can maybe learn more about today from some of our speakers, but that's something that we hear. So that's all I have.
the stories are always powerful, but also as we are all ambassadors of this work, to have the numbers that you share, Britte, as I was taking my own notes on it, it does help to go back and explain why food is also important, or we can help relay the message, how critical it is. So thank you. Next, I have the privilege of introducing a woman who I think I can call a good friend. And Dr. Lora Overton, and she said in her self-introductions, is a practice OB-GYN work in this community for 30 years. She actually serves on the St. Joe Foundation board, really advising us to make sure we're technically accurate, as well as on anything we do, to make sure we're really following best practices. She also, when she stopped practicing medicine, became a professor. And it's a good reason. She teaches really well, and she's a delight to learn from and listen to. So I know that I'm up for learning a lot, and I hope you all too. So Dr. Lora, we'll turn it over to you to get us better educated on this topic with some of the facts we need to know.
Good morning. Good morning. I think it's still morning. So before I start my lecture, of course, let me make sure oh, there we go. Before I start my lecture, I want to just talk about a couple of things that I've seen this week in the news. So the first thing is, or the news or with my students. One of the first things that happened yesterday morning was I had a bunch of students who have children all talking about this new restaurant in town called Raising Cane. Okay? And so Raising Cane is this place where you can go and get breaded, fried chicken, right? Breaded, fried chicken with all these sugary spices that you can dip that chicken into with a bunch of fries. I don't know how many of my students said they're taking their kids there right after they finish class. Okay? So that's one thing. The other thing that I saw on the news, and I think it was last night, everybody was in a big up-to-do about, I think her name is Blue Ivy. That's Beyonce's daughter. There was this big thing on TV about her dress, what she was wearing to some award program. Okay? And so you've got a 12-year-old girl who looks like she's 18 or 19. Right? And it wasn't about the dress. For me, it was about her figure. And so one of the things that I teach my students is about 50 years ago, I grew up in rural Oklahoma, and every once in a while you'll hear that Oklahoma drawl come out. I grew up in rural Oklahoma, and one of the things that we did on a farm is that we fattened the calf. In order to fatten the calf, what we did is we fed the calf more grain, more, wheat, whatever. When we sent that calf to slaughter, we made more money the fatter the calf was, right? Okay, that just makes sense. Well, 50 years ago, that was one thing. 25, 30 years ago, they started adding hormones to our feeds and hormones to the grasses. And the cows got fatter faster, which meant that we made more money when we sold those cows at slaughter. The problem with that, adding hormones to the cows, okay, is that our children started drinking the milk from those cows. Our children started eating the food from those cows. And what happened was, instead of girls starting their menstrual cycles at 16, what we've seen for years, we now have girls starting their periods at 10, 11, and 12. So our 12-year-olds, instead of looking like 12-year-olds, are now looking like 18-year-olds. The other problem with that is our 12-year-olds have now started their periods, which means that they are fertile. So instead of being fertile at 16, they're fertile now at 10, 11, and 12. And with that fertility, yeah, they can get pregnant. With that fertility, they've got breasts and they got butt that looks just like a 17-year-old, okay? And the problem is they've got hormones raging through their bodies just like a 17-year-old does. And so it's not always the guy's problem. It's the girl who is now fertile at such a young age, and she's feeling herself, as my mother used to say. And so that all comes back down to food, right? So you say it doesn't affect you or doesn't affect you. Yeah, it does, in ways that you don't even see. In ways that you don't even see. So let's talk a little bit about nutrition here. I keep hitting the wrong thing, I think. Okay, here we go. So how much should we be eating? Females, about 16 to 2,400 calories a day. During pregnancy and breastfeeding, an additional 300 to 400 calories a day. That's not, and I tell my students, that's not 300 to 400 calories every meal. That's in the whole day, okay? I used to tell my patients you can gain 25 to 35 pounds in this pregnancy. By 6 weeks, you'll have lost 25 to 30 pounds. Okay, if you gain more than 35 pounds, that's you. That's not baby. You're not eating for two. You're eating for one, okay? Males, again, 2,000 to 3,000 calories, and again, shouldn't eat less than 15,000. So I've got in your handout the pluses and minuses of that. Let's talk about how do I choose what I eat. And again, you've got some handouts there that are going to talk to you about talking to your patients about what they should eat and what they shouldn't eat. Let me tell you, I am not a nutritionist. The things that help me is a nutritionist, right? A registered dietitian helped me get my eating plan together. Also will help you get you and your patients' eating plans together. Now, when I needed to see a registered dietitian, my doctor promptly told me that my insurance wouldn't pay for it. You're going to run into that problem a lot, okay? But I said, you know what? It's worth it for me. I'm paying for it out of my pocket. You can get some free dietitians at certain places. I know that we have dietitians at certain food pantries that will help them with their meal planning. But asking your patients, talk to your patients about healthy eating routines, it all starts with a conversation. That's my main point with this. Now, we have these handouts for you, and we'll be glad to put them on our website. But really, starting the conversation. What does your dinner time look like? How often are you going to McDonald's and getting McNuggets for your kids? Can you instead buy that chicken breast at Kroger's or Aldi's, cut it up yourself, and cook it for your kids? Would that be a healthier alternative than going to McDonald's? For poor patients, let me just tell you, it may not be, because poor patients only have a certain amount of money. And that's a problem. That's a problem, especially in the United States, okay, where we are the richest nation in the world, and yet we are killing our kids with what we eat. Okay, who does the grocery shopping? When you're thirsty, what do you reach for? Is it a soda or is it water? One of the big wake-up calls for me was talking about whole fruits and whole grains. I did not know that there was a difference between whole wheat bread and multigrain bread. So little things can help you as far as the nutritionist goes. But this is a great handout. And then customizing dietary framework, again, it all starts with the conversation, if you will. Okay, so those handouts are for you. The other question that I generally get is, this is USDA My Plate, is when patients come to me, they'll say, well, can you give me a pill for my, obesity problem? Can you no, I can't. I don't do that. But there are internists who will, if it's a problem, medical problem. I always send them to USDA My Plate. And I say, this is what your plate should look like, okay? You should have, protein about the size of the palm of your hand, if you will, lots of fruits and lots of vegetables on your plate, etc. The next question I usually get is, what about vitamins? Aren't all vitamins good for me? No, they're not. No, they're not. Okay, so I will have people walk up to me with a handful of vitamins and say, I'm taking this, 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 and this. And vitamins are good for you, right? Well, the reason why I put this in your handout, or I have this, is to show you that water-soluble vitamins simply means that they're dissolved in water. So you drink water, they're dissolved. Most of them wash out of your system within an hour. So overtaking vitamins is simply a waste of money when they're water-soluble, because they wash out of your system. When they don't wash out of your system, they can cause abnormalities or problems. The big ones that I want to talk about are the fat-soluble vitamins. They are absorbed with fats or lipids. When you overtake these vitamins, on the other hand, you see that it can cause things like blindness, impaired immunity, headache, irritability, blurred vision, deformities in children, bone softening, brain damage, cardiovascular and kidney damage. degeneration of the nervous system, defective blood clotting, and anemia. Okay? Did you know that vitamins, simple vitamins, could do all of that stuff? And most of our patients don't either. Okay? So I always tell my patients and my students, it's best to get your vitamins in the foods that you eat. Those green leafy vegetables that everybody hates eating, you know, that wonderful salad over there with all the veggies in it. Yeah, that's where you should get your vitamins. Prenatal vitamins are an absolute necessity, but they are regulated. So people only take one prenatal, maybe 2 prenatal vitamins a day, and you're not going to overtake those. And the folic acid in the prenatal vitamin is absolutely necessary for the baby's to prevent spina bifida. You know what spina bifida is? It's the open spinal cord for the baby, neural tube defects. But yeah, prenatal vitamins are an absolute, and especially when you're pregnant and when you're breastfeeding, prenatal vitamins are a necessity. Okay. So let's talk about some developmental aspects. And let me just tell you again, I am not a nutritionist, but I've seen lots and lots of pregnant women over these years. Okay? And I have my own health journey. Okay? So good nutrition is essential in utero and throughout life, especially for those of you that, I thought I heard somebody from WIC over here. They'll tell you, especially in the first 3 years of that baby's life. Fetal growth and development require adequate calories, proteins, and vitamins, especially for brain growth. Inadequate nutrition in the first 3 years leads to mental defects. And I tell my students all the time, please, please, please do not water down the formula. I know you want to stretch that formula because it's expensive for those of them that are not on WIC, but when you water down the formula, that baby doesn't get its nutrition that it needs for adequate brain growth. And so what happens is you get a baby, that may be a little chubbier, looks chubby, looks fine, not crying at night because you've watered down the formula, but by the 3rd grade, they can't read because their brain hasn't had a chance to adequately grow and nourish itself. Okay? Learning disorders, because the growth continues until this time. So again, up until 3, we want to make sure we're not watering down formula. And I know we do formula until 1 year of age. Some people do it a little bit longer, especially those who breastfeed may breastfeed just a little bit longer than that. Okay? After the first 3 years, growth in children needs to be adequate. Nutrients for metabolism, tissue maintenance, and repair. I keep hitting the wrong thing, sorry. Effects of malnutrition. Let's talk about, all those chicken McNuggets that they eat every single day without any fruits or vegetables. Children suffer from growth retardation as a result of poor diets. They tend to be at greater risk for illnesses and death. They have decreased immune system. Stunting is the result of long-term nutritional deprivation, often results in delayed mental development, poor school performance, and reduced intellectual capacity. So if your children, the kids that you see are not progressing in grade school, it may be because they're not getting a good breakfast. Okay? Even to this day, I grew up poor in rural Oklahoma, but we always left home and had breakfast at home. Okay? We always had breakfast at home, which means that I have breakfast now. Before I leave the house, I can't go without breakfast. Okay? Wasting in children is a symptom of acute undernutrition, usually as a consequence of insufficient food intake. Wasting impairs the functioning of the immune system, can lead to increased severity and duration and susceptibility of infectious diseases, and increased risk of death. Obesity. I think we talked about obesity just a little bit. Obesity-related diseases, chronic low-grade systemic inflammation, insulin resistance and type 2 diabetes, higher incidence of osteoarthritis, arteriosclerosis, my dad used to call that hardening of the arteries, we know what that is, hypertension, heart disease, and cancer. Current U.S. statistics, and this was an eye-opener for me, adults, 32% are overweight, an additional 42% is obese. That's 74% of Americans. That blew me away. 74% of Americans. Approximately 10% of these have diabetes. In kids, and this is also blew me away, and I tell my students, I don't see this number getting any better. 19% of children are obese. 40 years ago, it was only 5%. And why don't I see that getting any better? Most of you who have children are working parents, right? So after you spent 8 or 9 hours at the office and your spouse or your partner spent 8 or 9 hours at the office, how many of you feel like taking your kids to the park to play? Probably not many of you feel like doing that. So kids are at home playing on their video games, sitting in a chair because they're not outside playing. Even if you have a fenced-in backyard, most parents want to be back there if they have young children. Why? There's pedophiles everywhere. And so you don't let your kids out of the house by themselves most of the time. So that's why I don't see this number getting any better for kids. Something has to change. Something has to change. Obesity in childhood. Obese children and adolescents are likely to suffer from both short-term and long-term consequences, the most significant being cardiovascular diseases, mainly heart disease and stroke, diabetes, musculoskeletal disorders, especially osteoarthritis, cancer of the endometrium, breast, and colon. Increased risk of all of those. So I want to talk about this and just a little bit. Approximately 32% of the U.S. population has 3 of these 5 factors, and this is called metabolic syndrome. And I bring this up because of that 74% that I talked about. Metabolic syndrome is increased waist circumference, increased blood pressure, increased blood glucose, increased blood triglycerides, and decreased HDL cholesterol. HDL cholesterol is your good cholesterol. It's the one that gets fat out of your blood vessels and washes it out of your body. HDL cholesterol goes down as we go through menopause, okay? As we go through menopause. So, approximately 32% of the U.S. population has 3 of these 5 factors. Metabolic syndrome is a cluster of 5 risk factors that double the chance of getting heart disease and stroke and increase the chance of developing type 2 diabetes 5 times. So is there any wonder that we're seeing 10, 12, 15, 16-year-olds with type 2 diabetes? So beware of what you eat or don't eat, because what you eat or don't eat will determine your health status. And that makes a difference for all of us, because if you're an employer, how many of your people are going to be out of work because of diabetes, hypertension, all of those things? If you're a co-worker, how many of your co-workers are you going to have to pick up the slack for because they're off, because they're sick? It starts with the conversation. And if we start this conversation with pregnant women, with pregnant moms saying that, you know what, this is going to help your baby do better, then maybe we can change the tide of that 74% of Americans. It just starts with the conversation. Yeah, I know it's going to be hard to get some patients to change their ways and change what they're doing. But if you just start the conversation, that'll help. Okay? All right. Thank you.
Thank you, Dr. Overton. Just a quick reminder, we will have this presentation on our website after the new year, so look out for that, as well as the handouts. The handouts were really similar, and there was a few of us putting them on the table. So if you didn't get one, or if you got a double of one, just know that we'll be posting these, and there's extra available if you guys want to take some. Next, we are going to hear from Jackie Schenkel. Just a little bit about Jackie. Her name is Jackie, like mine, so we're already cool. She graduated from Purdue University with a Bachelor's of Science in Nutrition, Fitness, and Health. After that, she moved to Fort Wayne and has been working at the Allen County WIC office for 8.5 years. She started off as a nutritionist and then moved on to the nutrition coordinator role. And most recently, she has taken on quite the role of the interim senior WIC director. So please help me welcome Jackie to talk a little bit about WIC benefits and their breastfeeding support.
Perfect. All right. Hello, everyone. Can everyone hear me? Good. All right. So my name is Jackie Schenkel, and like Jackie said, I am the Interim Senior WIC Director for WIC, or also known as Women's, Infants, and Children. So just kind of a show of hands, who all here has heard of the WIC program? A lot of people. Good, good. So just kind of a general summary of what WIC is if you haven't heard of it. WIC, or Women, Infants, and Children, is a nationally recognized nutrition program that helps improve access to nutritious foods and promotes healthy eating and lifestyles. On average, we serve about 145,000 women, infants, and children each month, just through a network of 140 WIC clinics statewide. So during these appointments, WIC staff help provide nutrition education, lactation assistance, and referrals to appropriate resources in the community. So I'm sure a lot of you have probably gotten some referrals from us with our clients. So who is eligible for WIC? So first criteria is you have to either be pregnant, postpartum, or child from birth to 5 years of age. And if you meet one of those categories, then you must be a resident of Indiana, and you must meet the household income guidelines. And so we go off the income limit of 185% of the federal poverty guidelines. If they do have Medicaid, SNAP, or TANF, they are automatically eligible income-wise for WIC as well. And also foster children are automatically qualified for WIC too. So what happens during a WIC appointment? So this we're going to go on like a little journey here. So imagine that you are a brand new pregnant mom going to your first WIC appointment. So what's going to happen is you're going to go into your scheduled appointment time at the WIC office, and you're going to go through that intake process. So that intake process is just determining if you are eligible for the program. So they have you sign some paperwork. They ask for your ID, your proof of residency, and then your proof of income. So if you have any of those previous programs, the Medicaid, SNAP, TANF, we can look that up and use that as your proof of income. If you don't, then we'll use the last 30 days of the household's income. And then once we determine that you are eligible through that process, then you are taken to one of our nutrition staff. We have registered dietitians, registered nurses, and nutritionists. And during those appointments, we do weight, height, and we check hemoglobin levels. We also do health questions, so seeing how pregnancy is going, who's your doctor, taking any vitamins, how's eating going. We provide that nutrition education, breastfeeding education. We give resources, referrals at the client's request. And then we also give them benefits issued onto their Indiana WIC card, which I do have an example of what that does look like. So some of you may have seen these before, but this is just the WIC card that our clients can use at the store. There are certain stores that are approved for these, to use these. So Walmart, Kroger, Meijer, those stores are just a few examples that you can use these cards at. So what they do is when it's time to pay for their foods, they just swipe the card like a debit card, put in their 4-digit PIN, takes those foods off so that they don't have to pay for it. Anything else they got that's not on the WIC program, they would just either pay out of pocket or use a different form of payment method for that. So these are just some examples of benefits and food packages that they can get. So clients are prescribed a food package based on their category. So depending on if they're pregnant, postpartum, baby, or a child 2 years of age. The postpartum one gets a little tricky because your food package is tailored based on how we are feeding baby. So if we are doing fully breastfeeding, you might get a little bit extra foods to help support that nutrition. Or if you're doing fully formula feeding, you're gonna get formula on your card, maybe just a little bit less food. So it just really depends on what your category is. So some examples of foods that they can get are milk, cheese, eggs, cereal, juice, dried and canned beans, peanut butter, whole grain bread, tortillas, brown rice, fruits and vegetables, tofu, yogurt, formula for infants who are doing both the combo feedings of breastfeeding and formula feeding, or doing not doing breastfeeding. And then also they get infant foods for infants 6+ months of age. And so also too, our clients have access to a WIC app that they can use as well. They can use this WIC app to check their benefits balance. So on their app, it will tell them you have this much milk left, you have this much dollars of fruits and vegetables left. It tells them the dates they can use those benefits as well. They can also use the app to scan the UPC codes of that product while they're shopping to see if it's eligible before they go up to the cash register. They get alerts for appointments and expiring benefits, and then they can also use the map to find the nearest WIC clinic and WIC-approved store that they can use their card at. And then last thing is we do provide lactation services as well. We have breastfeeding staff on site at our clinic. So we have our peer counselors who basically they are there to help encourage our moms and help educate them on breastfeeding. Typically, they are moms themselves who have breastfed and who are also on the WIC program or have been on the WIC program in the past. And we also have an IBCLC, or an International Board of Lactation Consultant, for any of those more complex breastfeeding issues that our moms might be facing. They help provide breastfeeding education support during pregnancy and postpartum. They help with any latching assistance, help with doing different breastfeeding positions that work best for mom and baby. They can help with any loaner pumps or get assistance with applying for insurance pumps. And then also too, I think this is really cool, is that they offer a 24/7 availability for any breastfeeding assistance and support. So they always have someone on call with a phone. These moms can call, they can text, doesn't matter what time it is, what day it is, holiday. There's always someone on call and they can talk to them about any breastfeeding needs that they have. And if you want any more information, you can go to the Indiana WIC's website right here, and there's lots of other information and resources on there as well too. That is all I have. Any other questions? Yes. Mm-hmm. Yes. Correct. Mm-hmm. Mm-hmm. Yes, yep, that is correct, yeah. So if there was a miscarriage or, like you said, a pregnancy loss, like you said, they are eligible to get WIC benefits to support them through that nutrition for that 6 months postpartum. Mm-hmm. Mm-hmm. Yeah. So we have our standard formula that we do offer. We have our contract with Infamil. So we do the standard Infamil infant, Gentilese, and the Prosobi soy. But if there is a baby who has any allergies, like you mentioned, or a preemie who might need NeoSure, we can offer that. We would just need a prescription from their pediatrician stating the medical reason and how long they need it for. If baby foods are allowed at 6 months, and then once they get that form filled out, they give it to us, then we can add that appropriate formula to their benefits. And also too, with specialty formulas, if they have Medicaid, we can also help apply through IU Health for them to get the formula sent to their house as well too. We can help with that process. Yeah. Nope, it's a different number. Yes. Yeah. Yeah, we typically have business cards that we give out, but I can send over the number for that. I can give that to Jackie whenever she sends it out, just so you guys have all of that. So. Mm-hmm. Yeah. Mm-hmm. Yeah, so each state, pretty much the general overview, it is very similar to each other. There's going to be some states where some of the foods might be a little bit different, or the formula is going to be a different contract formula. I believe Ohio, I think they have a contract with, I can't remember if it's Infamil or Similac, but I know there are some states that had the contract with Similac as well. We used to have the contract with Gerber, and then we swapped over to Infamil last year. So I would say that's probably the big difference, is just the different formulas. When it comes to foods, they're all pretty much the same. You might see more of like different brands of, like, for example, like the whole grain bread. Like Ohio might have different brands than what Indiana allows, but pretty much the same. Oh, yeah. Yeah, like, what do you mean? Like, so I've worked in the past with a lot of clients that aren't here Mhm.
whether they be on sister visa or just no visa at all, like no status at all. And was often always struggling with connecting to resources that they were actually eligible for.
Mhm.
Now with WIC, from what I remember, I believe when I was doing it, I thought it was the residency that they must have.
Mhm.
And so I don't know if that's changed or if you could speak a little bit about that.
Yeah. So really the only thing we look at with residency is basically we just look and see, do they have an address that's here in Indiana? That's pretty much what we look at. We have some families who may be living with a friend or a family member, and when it comes to that, really all we need is just that family member or friend to write a note just saying, I certify that this person lives at my address of blank, and then they sign phone number, and we can use that as a proof of address. Mhm. Yeah, so like when you say like a state ID. Mhm. Yep. Mhm. Yep, so they could use for IDs we can use if they have medical records or if they have a bill with their name in it. I'm trying to think what else. Mm-mm. Yep, just their name. Mhm. Yeah, so we can use multiple different forms. We've had some clients who will use a student ID for their proof of identity, and then they'll have maybe a letter in the like from a doctor's office with their address on it, or if their mom wrote them a residency letter, and then like income, if they have pay stubs, we can use those, or if they have the Medicaid, we can use Medicaid for ID, income, and residency if it all matches with that. So we do have some clients who are on emergency Medicaid, and we can use that, and that they will qualify. Yep, we can use those. Yes, I've actually checked in some people with the ID, and it throws me off because I'm like, well, here's the birthday. Yep. Yeah, we can use that. It's all yes. Yeah, that does get a little tricky with it. So if they are if they're working for someone, they can get something from their employer saying like, I'm paying them cash, this much money every week. If they're not working, but they are living with someone, and if they're helping them pay for bills, then we would need to use the person that they're living with income for that. But if they're their own separate household and they're taking care of themselves, but they just have a place to live at that person's house, then we would just count them as their own family unit. We can also use bank statements too. No. No. Yes, I can. Thank you, Belinda. So I don't know if some people are aware, but we just had a ribbon cutting for our WIC mobile lactation unit. So we're going to be serving in, I remember the counties. It's Adams, Wells, Jay, Huntington, I think Randolph. I might be missing one, or Blackford as well. So basically it's a grant that we got from WIC, from the USDA, and we got a mobile unit that has a bathroom, a sink, and we're going to go to all those different counties where they may not have as many resources to get lactation assistance. So we're going to be out and just parked in those communities, and any of these moms can come over and they can get some breastfeeding assistance on the van, and they can already be WIC clients or they can be potential. We wouldn't turn anyone away. We would basically just say, if they're not on WIC, we would just help them out and then just say, here is a WIC office that you might be eligible for, and you can go ahead and go there. But they're helping with latching assistance as well, pumps, hand pumps, breastfeeding education, all that. So we're hoping, our goal is to improve our 3 and 6 month breastfeeding duration rates in those areas. Any other questions? Yeah. Yeah. So we actually got a bunch of pumps that the Indiana State Office has sent to us that we can give out. So we can help with like maybe applying for an insurance pump. If we can't go that route, then we can help them with getting a keeper pump that we have on the van. Or even if they prefer to have a hand pump, we can help with the hand pump as well too. But yeah, a lot of different routes of what we can do. It just really depends on their situation and what all we can do, but we will try our best to at least get them something. Yeah. Yes, so when I hear that, I usually assume it's that they had missed an appointment. So if we try to do our benefits on a 3-month intervals, so really they only have to come into the office maybe 3-4 times a year. So if they miss that appointment, then the benefits don't get reloaded, and so then they would lose their benefits until they come into the office for that next appointment. Also, another thing I could think that might be what's going on as well is that depending on their postpartum status, so if they are doing more formula or they're doing no breastfeeding, then they're eligible for 6 months postpartum. But if they're doing mostly breastfeeding or fully breastfeeding, then they are eligible for a year postpartum. So that might be something too, like if they had lost it at the 6 months and it's just baby at that point, or if they missed their appointment. But really just something just coming into the office and getting your benefits reissued. Yeah.
Did you see any data behind when COVID time was around and you could do the appointments virtually? Right? You didn't have to come into the office. And now with, I think you guys are back into the office, right?
We are, yes.
And as we all know, understanding transportation is such a huge barrier. Have you seen that at all, or what are your thoughts behind that? Do you guys have hybrid options, or is it you have to come?
Yeah. So I know with COVID it was kind of tricky because we were doing those virtual appointments, but we didn't need proof of anything. We were taking everyone's word for it, basically. So our numbers skyrocketed, basically. But then once we went back in office, definitely there was a little bit of a drop off there. But there are some hybrid options that we can do. So for a certification, like for their first brand new appointment, they do have to come into the office for that. And then depending on what they're due next time, so for example, you're pregnant and you go in for that first certification appointment. If you are not considered high risk, like depending on your weight gain or if you're underweight before pregnancy or anything that's going on, if you're not high risk, then we can do the option for the next appointment to be an online video that they can do on their WIC app, which I forgot to put on there in that slide, but they can do an online video and that would count as their appointment, and then we can issue 3 more months of benefits. Yeah. Yes. Like the mobile units, or you mean the clinics? We have 1 mobile unit. Yes, so on the Neighborhood Health website, if you go under the WIC category, we do have our schedule for which locations we're going to be at. So we have all of December on there, and then when January comes, we'll post the January schedule. And we also have a Facebook page as well, if anyone wants to follow it, WIC Mobile Lactation Neighborhood Health. We post where we're going to be at those days as well, too, on our Facebook page. Yeah. Awesome. Good questions, guys. We're all good. Awesome. Yeah. Thank you.
Okay, that was really great. Apparently I had a lot of questions still. Okay, so we are going to move on to our local food pantry resources. We're going to do this panel style so that we all have a chance to ask questions. So I am going to have Julie Reece from Associated Churches be up here, as well as, is Joel Bowerman here? Oh, he walked right in, see? I remember you saying you could come towards the later end, but I have never seen you, so you're right on cue. And then Philip Pelz from Wellspring. Okay, so if we want to just do short introductions, Julie, I know that you have already introduced yourself. So if we want to move on to Philip, we'll just do short introductions, who you're with and what your role is there.
Testing. There we go. Joel Bowerman, Director of Programs for Community Harvest Food Bank.
And Phil Pelz again, Director of Operations, Wellspring.
Great. So I'm just going to kick it off with a few questions that I think fit right in, because I know from Britte was saying some of the confusion around food bank services, hours, eligibility. So I'm just going to ask a few that I think everybody will appreciate as much as I would have as doing direct services. Can you tell me a little bit, and we'll go down starting with you, Julie. What are the main food resources within Associated Churches, and if there's any requirements around those, and maybe locations, just an overview.
Okay, thank you. Yes, so Associated Churches is it has a main warehouse, and then there's 21 food pantries which are located throughout Allen County, and they're in 21 churches and other community centers throughout Fort Wayne and Allen County. So I brought some pamphlets. I didn't bring enough for everyone. I should have, because I was thinking I would just refer you to the Associated Churches website, and if you go on that, you will find under the Neighborhood Food Network a list of all of the churches and community centers where the food pantries are located, along with like their address and the hours of operation. Most of them are like 1, maybe 2 days a week for a couple hours at a time. So, but Wellspring, their hours are longer and more days, which is wonderful. They're a great resource for the food pantries as well. Yeah, so that's the different places where they can go. As far as eligibility, really, no one is turned away if it's a crisis. It is a 5-day food supply, emergency food supply. They do request that that clients coming into the food banks would have an ID and a piece of mail that would have their address on it. It is preferred, but not an absolute. And I'm sorry, I don't do the food bank, so I do have to kind of look at a few notes here. But the other thing that I would like you to know about the food bank is that let's say you have a client on a Friday who is really in need of food, needs food for over the weekend. If you call Associated Churches, that is the caseworker, the case manager, whoever's managing this client. If you call and we're able to come and pick up a supply of food for the family, associated churches could get that around if the case manager was to come and pick it up and deliver it to the family. It's not something that we're asking for case managers to let the client know to call us, because we need it to go through the case managers or the caseworkers. So, but that is something too that's a possibility if a family is really in need of food and there's just not any other options out there. We can do that.
Thank you, Julie. And also, we will scan the information that you have, and we'll post it as well.
Okay. Yeah.
So, yeah.
Yeah, so Community Harvest, it's got its kinks and quirks that need worked out as well, I think. Initially, when you think food bank, you think you should be able to just show up there and receive assistance. Unfortunately, that's not the case for everyone. Now, if you are, we can get you 50 pounds of food every month if you're a veteran or you're the spouse of a veteran. All you need is the military ID and DD-214 form, I believe it is. But if you're just an average Joe like myself coming off the street, we do have emergency crisis bags that we can supplement about 10 pounds of food in and give you right away. Community Harvest works with about 350 partner agencies like Wellspring and like associated churches. The food bank then distributes that food to those agency partners. And so we rely heavily on those agency partners to distribute the food in the areas that are most underserved where they're located. Now, that being said, too, just to complicate things even more, Community Harvest does have an on-site pantry. It's called Community Cupboard. And through the help of our agency partners, some of them can issue vouchers. Not all of our agency partners are equipped, or they're not, they don't have the status to issue vouchers, but a lot of them do. And I put a list back there of some of the agencies in Allen, and we serve a 9-county spread. So I don't know if everyone in here is from Allen County, but we serve all the counties surrounding Allen as well. So depending on where you're located, that sheet should be able to kind of point you in the right direction at what resources you'll have available in your area. We also do what's called a farm wagon. I've got information that's back there about that. I see a lot of people shaking their head. That's good to hear. And what the farm wagon is, that's a no questions asked. You pull up on, depending on the day and time, we do one in the morning and one in the afternoon. And depending on the county and location is dependent on the day. And we'll load you up. That's a supplemental program as well. About 25 to 30 pounds of food. Now here lately, we have, anywhere I've seen as high as 70 pounds of food per day, or per household. It just depends on what we have on hand. All that product that we distribute through the farm wagon is donated product. So if donations are looking good, we're going to be able to get more out to you. 70, 50, 30, you're not going to leave with any less than probably 20 to 25 pounds though, which is awesome. So that's another opportunity there for not having to fill out paperwork and jump through the hoops. You just show up there and it will be provided. So those are some of the opportunities. Yes. You know what? Shame on me, because we do, and I only brought the English one. And I need to see, there's no reason why that shouldn't be on our website as well. Do you know where to find that on our website? If you go to the programs tab up at the top, I think Farm Wagon is an option, or if you click on the programs, then it'll take you to where you can see Farm Wagon, and then I think there's a viewable printable schedule that you can click on. I'm curious now if we have the other languages posted on there. done.
So, like they were saying, we get a lot of our food from Associated Churches and from Community Harvest, and we're open every single day. It's on the flyer, so it's a little complicated. Monday, Wednesday, Friday mornings, 9 till 10. Anybody, if you live in Allen County, you can come in and get free food, no questions asked. You don't need to provide. You provide an address, but you don't need to provide like a proof of your address. You just say an address. With the rise in the homeless population, if they say, I just got here off of a taxi, don't know what to do, we give them their food, and we just write down the rescue mission counts as their address, and then we label it with different apartment numbers. So that's pretty nice. And then on Tuesdays and Thursdays, it's in the afternoon and evening. And then in addition to that, kind of like the farm wagon, we have what we call WOW, or Wellspring on Wheels, and that's where we go out to 8 different locations, food deserts, and some rural areas that just are in need of extra help. Same thing, no questions asked. They do need to provide an address in Allen County, and we sort of hand them food through their window so they don't even need to get out of their car. If it's nice, more than welcome to. On today, stay in your car.
Hello? Okay. Also, too, with Burmese, a lot of them are illiterate, unfortunately, so the handouts, as much as they're helpful for us, they won't be able to read them just as that, because a lot of my families do not read that.
I was just going to ask, I know Miss Julie, did I say that right? Miss Julie, you spoke about having a letter, bringing in a letter. Would a letter from the department of our clients needing food, would that also be self-sufficient if they brought a letter in from us?
Yeah, that would work too,
Okay.
yes.
And then in that letter, can we be as detailed? I know it's kind of hard. As I say this because our clients need to bring food during visits, during our supervised visits. And some of our kids come with a lot of allergies. Some of our kids come with just a lot of different food types. Not saying to go get them McDonald's or anything, but it's just some difficulty sometimes. So I was wondering, in that letter, can we specify what they really need for the visit? Can it be something as detailed as that, or is it something like this is for the collective?
Yeah. So you're in. Remind me
I'm
what
with the
your
Department
visits
of Services.
Oh, okay. So I mean, I can't. I guess I can't answer that
Okay,
question
that's
real
fine.
well, but I will definitely look.
Okay.
I will check into that, and if you get me your contact information, I would be happy to respond to that for
Okay.
you.
Because-
So your question is, if children have food allergies, can the food that is going to the homes where they're
Visits. So I had a 2-part. I'm sorry.
okay?
So the 2-part was, can we provide our clients a letter to provide to you guys to ensure that they have the food for the kids during visits? It then compounded on that, can we specify if our kids have allergies or not? Because our parents are required to have food for the kids during visits. Visits last between an hour or 2 hours, depending on when they are, and they're multiple times a week. Some is two times a week, some is 3 times a week. It kind of depends on the need and the age of the children. But the barrier that we have is that some of our parents cannot participate in visits, or their visits are being short because they don't have the supply of food.
Gotcha. Well, I think that sounds like it would be something like case by case kind of thing. And I think that it would be a good call to make as a case manager to Associated Churches and say specifically, this mom needs food that is, that doesn't have peanuts, or, whatever the case might be. And that could be something that we could arrange to get to you as the case manager so that you could deliver it to the mom.
Okay.
Does that make sense?
Yeah.
Yeah. Okay. Thank you.
I don't know what they mean by the good food. I mean, my hope is the kind of food that we're presenting it. So I don't know, does that mean what kind of foods are available when they go to like the WOW or the wagons and kind of things? Because I know sometimes we receive food that's left over at a Mother's Hope. But what kind of food do they actually get when they go to those, opportunities? Are they, is it good food? I'm assuming maybe not like random beans. I don't know, but that's what they say when they call residents that leave. Like, where can I go to get the good food? I don't know.
So, that you said that they want to receive it, or that they are receiving it?
They know that they need the food, right, and that their pantry is getting low. So in my mind, the bread or the peanut butter or the macaroni and cheese, they don't want like canned carrots or the beans, that kind of stuff like that. So, and again, the transportation, they may only be able to get out of the house if they have a ride or if they have gas money, that kind of thing. So they want to make it worthwhile to their trip that they're going to be able to get food that their children are actually going to eat that's healthy. And so I don't know. I mean, we give them all the resources, but when they ask me, well, is it one that has the good food? I don't tell them what that means.
Yeah, I guess it probably depends on who you talk to with everyone's different preferences. But yeah, so the farm wagons, with the name, it is supposed to be produce heavy. So you're going to get more produce than anything. Now, that the same thing being said, does everybody know or heard of TFAP? It's the Emergency Food Assistance Program. It's a program through the state, and Community Harvest is a part of that. We receive a certain order every other week, and we're then able to distribute that on farm wagons. The kind of caveat to that, I guess, is you do, in order to receive the TFAP, you do just have to fill out your name and address and your household size and just let us know that information, and you can receive TFAP. And TFAPs, it's a wide variety too. It's anywhere, like we were handing out raisins the other day, pouch chicken. We were handing out pork loins, a big old like a 10-pound pork loin, which is awesome protein. But that's a wide variety too. But with that, in hopes of distributing that TFAP, we kind of wanted to, for lack of a better word, beef up that farm wagon and make a little bit more options as far as food go. So that just got implemented back in the beginning of October. So farm wagons, from my view, have gotten a lot better as far as the selection and what we have to offer go.
I'll piggyback on that. I think good is, like you said, it's like depends on what you're defining. We hired a nutritionist this past year with some foundation dollars and some private donors who said, hey, like some people would say, I don't want that fresh produce. But if they come to a class, then they leave every single week until the next class. They can come back and get it with 2 big bags of fresh produce. So we're trying to get that healthy food into their hands. But some people, when they get it, say, well, I don't want this. I want Doritos. So it's tough to say what's good. Well, we know what's good, but it's tough to define how they would say what's good.
Kind of.
Helped with some of the education on those. Sometimes they just don't know how to cut them and prep them. And sometimes we've had kids where they see corn and they think canned corn, and you're giving them fresh corn, and they're like, you have to convince them to eat it, and they're just blown away that they love it. So it's just that little education goes a long way. So if we can just encourage them to try it, and teach them how to prep it, maybe you'll get more people taking it.
We've had similar with, there's something wrong with your carrots you're handing out.
Oh, shucks.
With the green on the top. And it's like, no, that's, you know,
That's
it
legit.
is laughable for some, but it's like, well, this is the reality of, I've never seen a carrot with the green on the top.
Yes.
So, yeah.
Yes. I know one of Shepherd's Hand's dreams, we have a little bucket garden, but our dream would be to have a community garden so they can come and see how they're grown. So that would be lovely.
I had another question, kind of a little, building off some of the others. We talked about the different languages, but we have different groups in our community, particularly out of the Burmese, who really have different food preferences. How do you all do culturally competence in some of our immigrant populations? How do you serve them? Can you serve them?
I was just talking to our food bank director who just took over recently, and she's doing a fantastic job, but it is difficult. And she was saying it's almost like a moving target. So especially what she's hearing from her clients, maybe almost kind of like defining what is good. When we go to a high Burmese population, we're only taking fish. So a lot of times it's tough because you don't have unlimited resources, so you're trying to plan out what your schedule looks like for a whole month of, hey, we got to save this fish, and or hey, they might eat a lot of legumes, we have to save these legumes, and trying to really pack it full so that when we're going out into the community, you're making a difference in that community and that they're actually going to take it home and eat it versus, I don't know how to cook this, you know, I've never seen this before. If I've never seen it before, I don't know how to cook it. It's probably just going to go in the trash. So being really intentional about it.
Which are some of the communities that you've served that who are the ones who want fish, who are the ones who want the legumes? So if people have clients who are in different cultural groups, it might be helpful to know which ones you guys have developed a pretty good understanding of how to address their needs.
Yeah, and we have a list on our back of all those 8 locations that we go, but it used to be Autumn Woods. We just switched it just for parking issues. No issues with that on the, now we'll meet at the League for the Disabled and Blind in their parking lot. That's strictly fish. When we were trying to give out any type of any other meat protein, they just didn't want it, or they'd come back the next month and say, we don't eat that. So the League on that one is specifically all fish.
Do you stay centrally located, or do you go anywhere else?
We go 8 different locations all over Fort Wayne. So we go all the way up to, or not, I shouldn't say Fort Wayne, Allen County. We go all the way up to Arcola, and then it's just spread throughout Fort Wayne.
Okay. And I say that because of large population that we have, a lot of our parents are homeless, and a lot of our parents live in the hotel areas around Goshen and Coliseum. So are you anywhere in that area? Because we have clients that's in the Fort Wayne end, suburban end, travel end, Motel 8, everything that's up and down Coliseum and Goshen. That's where a lot of our population is, and that even going back to my first statement about having them have that letter so that they could do the visits, because a lot of those that live there, you know, living in them small motel rooms, they don't have the food to provide for the visits. So it's like they're getting, you know, the facilitator is knocking them, and then we're reading it that they wasn't prepared, and then, you know, all that standard language, we're not going to go there, but it's just, you know, they're not prepared, they're unprepared, they don't have, you know, the kids were acting out because they didn't get you know, and all of revolves around food. So yeah, that's why I asked, are you anywhere in that area or anywhere close where they can maybe walk? Now that it's winter, not too sure, but at least somewhere over there.
I might be bad at maps. The first thing I'm thinking is we just changed our location from Headwaters, which I don't know how far, Headwaters Church. I don't know how far of a walk that is, North Wells. I would have to look at the locations and put them on a map, and then it's almost like a 6-month rotating target. So we look and say, hey, people aren't coming here, we're going to change that location. Hey, people are coming here. And along with those, Tuesdays and Thursdays, they can come to as many of those as they want. We do try to partner with the Humane Shelter too, because again, traveling's tough, so getting cats and dog food is important too, so they don't have to drive one more place.
Also, St. Mark's Lutheran Church, wrong one. St. Matthew's Lutheran Church on Goshen Road has a food bank or food pantry. That's Wednesdays and Fridays from 9 to 11:30. So that should be close. Yeah.
If members in our audience, because they all have their own clients, are seeing patterns of need, they can reach out to any of you all to see if there's some solution, problem solving that can happen. I had the opportunity to work with all these agencies, and you guys are incredibly flexible in trying to listen to how do we reach the most people. So the flip side of that is the people in this room are the ones who are really the voices of many of the clients that are out there. So I encourage you, talk to them, or if you have trouble reaching them, reach Jackie or I, and we'll get you to start a conversation if there's a way to work with it.
I do want to be respectful of everyone's time. I do have to point out how amazing it is for that connection, right? I didn't catch your first name, Brittany, because you're keeping families to be able to visit each other. You're providing food and resources. So I think that is really what this is all about. So I really appreciate your engagement and all your great questions. I just thought that was really, really neat. Thank you to all our community partners for being here today. Thank you to all of you. We wrapped up yet another year. I do want to ask you guys, on the survey, there is a backside, and I really kind of wanted to wrap the year with just a few words of what you guys have thought about these luncheons. Just 2-3 words. It could be a quote, it could be something fun. But when I was doing boots on the direct services, boots on the ground work, I really always appreciated taking the time out to come to these personally, and not just because I'm on this side of it. I came to these for many years. Yes, they got us in with the nice lunch, but it was also a time to stop our everyday routine and network with same-like people that were all working towards the same mission of helping our community and our most underprivileged. So thank you so much. If you guys could take a few extra minutes to fill out the survey, especially that back question that's on the other side, I really appreciate it. And I think with that, if we don't have anything else, feel free to network as long as you want. But thank you again so much.
Production facilities provided by Access Fort Wayne. Learn more under the Services tab at acpl.info.